Hello, class. Today I will be modeling some DBT techniques, otherwise known as dialectical behavior therapy. I will be doing so in an individual session with a client. It is important to recognize that this is not the initial session and that I do have a history with this client. Her name is Samantha. She is 25 years old. She has a diagnosis of binge eating disorder and a history of self harm. She does live with her parents and cites her living arrangements as well as their dysfunctional relationship as one of her greater stressors. Hello, Samantha. Welcome in today. I'm so glad to see you. How has your past week been?
It was fine, I guess.
Okay. So I noticed that you're seemingly a little bit withdrawn today. And I know that it can be difficult to take all the things that happen in a whole week and try to dissect them, but why don't we go day by day? You tell me how everything was.
Well, Monday was actually pretty good. I had group skill therapy. We learned about mindfulness, which got me kind of excited for change. Um, Tuesday was all right. I had some anxiety, nothing out of the norm. I felt like I could handle it. Wednesday was bad. My parents got into an argument, so
Okay. So I really do want to talk about Wednesday more with you, but I think first it's really important to just commend your commitment to treatment. I know that group therapy can sometimes be a harder scenario for some individuals, and I know that learning new skills can feel uncomfortable, but your commitment and excitement to change and making those positive changes in your life really sticks out to me, and I'm just so glad that you're here with me today. So, why don't you tell me a little bit more about Wednesday and the argument your parents had?
uh, well, at dinner time, my parents got into a big fight. They started to scream and yell at each other, which made me feel really overwhelmed. And then somehow it ended up turning on me, and they said that I needed to pay more rent. I can't afford to pay more rent, so my anxiety just shot through the roof. I felt even more overwhelmed than before. And it kind of made me question, like, is it even worth it for me to be here?
Okay. So those are certainly some big emotions. Before we talk more about that, I just do want to remind you about my the importance of my mandatory reporting. I know, as we've talked about, you do have a history of self harm. So I do just want to ask you: have you had any want or intent to hurt yourself or others?
No, not right now. I really haven't had those feelings in a while.
Okay. All right. So going back to those emotions, then I am hearing that you had a lot of feelings of frustration and anxiety and just feeling generally overwhelmed. Is that correct?
Yeah.
Okay. So I know that those emotions during distressful times can be harder to deal with. It's also a natural reaction to, watching an argument and then all of a sudden you're a part of it and just having a situation that's out of your control feel so out of control. So why don't you tell me how you coped with that?
Well, it's not necessarily good behavior, but I did end up binging and I ate a whole pack of Oreos.
Okay. So maybe let's reframe that a little bit. Binging has been something that I would say has been a behavior of yours for a while. Is that correct?
Yeah.
Okay. So it's something that's comfortable. So in times of distress, when everything feels so out of control and so overwhelming, oftentimes we're seeking that comfort, and we're going to go with the behavior that is most comfortable for us, something that we've repeated. So it's completely reasonable and understandable why you would resort to binging. But why don't we talk about maybe a new skill set that could help you tolerate those distressful situations a little bit better, as well as regulate your own emotions in times where, everybody else feels a little bit out of control. Does that sound okay?
Yeah, we could try.
Okay. So have you ever heard of TIP before?
No.
Okay. So TIP is actually an acronym. The T stands for tip and temperature. Do you have anything cold lying around the house?
Um, well, I have frozen fruit in my freezer for smoothies.
Okay, that's perfect. So it could be anything from an orange to a banana or even just like a random bag of fruit. What you're going to do is you're just going to grab that out of the freezer And you're going to place it on both of your cheeks and over your eyes for 20 seconds at a time. What this does is it takes that, that heated temperature we often feel when we're angry and we're frustrated and all those negative emotions that come with a harder situation. And it literally tells our body that it's time to cool down. The second part of TIP is the I, which stands for intensive exercise. Now, I do want to preface this with saying I'm not expecting you to run a 5K in 15 minutes. I'm not expecting you to be an Ironman. Okay, this intervention is meant to be used in a number of situations in any way that you feel comfortable. So it's only going to be about 5 to 10 minutes worth of exercise. And what this is going to do is, first of all, it's going to deliver that dopamine to combat those negative emotions that you're feeling and really reinforce positivity within yourself. And it's also going to take those negative emotions and literally shake them out, So what are some exercises that you think would best fit this scenario?
Well, I like to go on walks and I like to jog.
Okay, that's perfect. Right? Just utilizing that just in 5 to 10 minute increments, that can make a big change for you. Now, the next part of TIP is the first P, which stands for paced breathing. So I would just want to practice this with you. What you're going to do is you're going to put your hand on your abdomen. We want to make sure that we feel this breathing in our abdomen and not our chest. It's also important we're going to take very slow, intentional breaths, right? We're not trying to speed up our breath and increase our anxiety or start hyperventilating. We want to make sure that we're trying to ground ourselves, and the goal is to relax. So you're only going to take about 5 to 6 breaths per minute. So what I want you to do is breathe in for 5, right? 1, 2, 3, 4, 5. Hold for 5. 1, 2, 3, 4, 5. And then exhale for 5. 1, 2, 3, 4, 5. Now, how do you feel after doing that?
Definitely makes me feel calm.
Okay, perfect, right? So we're actually going to pair that paced breathing with the second P in the last part of TIP, which is progressive muscle relaxation. Have you ever heard of that before?
No.
Okay, so I want to just repeat that exercise with you. We're going to add the second element. So put your hand on your stomach and then put your hand up. Now ready? When we inhale, we're going to flex our hand, right? So we're going to go 1, 2, 3, 4, 5. As we hold our breath, we're going to keep it flexed, right? And then we're going to exhale. And as we exhale, we're going to relax our hand. 1, 2, 3, 4, 5. Right? So this combines elements of that paced breathing and that intentional breath while also trying to relax areas that maybe we normally wouldn't realize we're even holding tension in the first place. A lot of people hold tension in their jaw or in their shoulders, and they don't even realize it until it starts bringing them physical pain. So you're going to do this by starting from your head all the way down to your toes, and just take each muscle group and tense and relax as you go on. Now, reflecting on this exercise, how do you feel about it? How do you feel about adding this to, your life?
I could see how it could benefit. I'm not 100% comfortable with it yet because it's so new, but I don't think it's bad.
Okay. On a scale of 1 to 10, where do you rate your comfortability with it?
Probably like a 6.
Okay, right? And that's perfect. Any new intervention, right? Any new strategy or skill set that we try to learn, it's important that we practice this. In times of distress, right? Like I said, it's normal to go back to something that feels comfortable, even if it's not a behavior that you want to continue. It's the option that feels the most available. So practicing this skill set in times where there isn't any stress and in safe spaces is incredibly important. So where are some spaces where you think you could practice this?
Well, outside in my backyard. I like to be outside when I feel overwhelmed or stressed. My bedroom is a safe space for me. Maybe instead of running for the exercise, I could do jumping jacks or something.
Okay, right. So that's perfect. That's the great thing about the tip technique is that you can swap out like that time limit, right? 5 to 10 minutes. Maybe you can't make the full 10 minutes. Maybe you need more than 5. Just doing 7 minutes of exercise and just choosing that, whether it changes daily, whether you're doing jumping jacks or running, it's very customizable. And that's important. I also just want to commend your self-awareness of, where those safe spaces are for you and areas that you could practice this that shows that you really do want to practice it. So, are there any situations coming up the next week where you think the skill set would really help you?
Well, I do have a job interview on Thursday that I'm feeling pretty anxious about. That's coming up.
Okay. So, in order to increase your comfortability with this intervention, how do you think you could add it to your life?
I guess I could try to practice it, like you said, a couple times a day, maybe before my job interview, so that the day of, when I feel very anxious, I might be able to utilize it and just help myself calm down before the interview.
Yeah, that sounds perfect. And I think that's a great situation where you know the date and time, you know how much time you have to prepare, you know your safe spaces, right? It sounds like you've got it all mapped out and that you're willing to practice. Am I hearing you correctly?
Yeah,
Okay.
definitely.
I know that nobody likes homework, but it is just like I said, practice makes perfect, and it's important that we utilize these skill sets at any time, not just in times where we're feeling close to crisis. So I am going to give you this. It just lists out that intervention that we just went over and the different letters that T stands for, that TIP stands for. So I look forward to seeing how you do with this intervention the next week. And I also want you to remember, last but not least, utilize your supports. Okay, you could always call our office. We're going to be open 9 to 9. So anytime during then where maybe you have a question about the strategy, maybe you need a little bit of extra support getting started practicing, and that's okay. So I just want you to reach out when you want to, okay?
Okay.
All right.
Thanks for letting me know.
Thank you so much for joining me today, and I really look forward to seeing you next session.
See you later.